Welcome to Eggs and Issues, a monthly business forum presented by the Portland Community Chamber of Commerce, bringing timely economic discussion to the region for nearly 40 years. Thank you to our sponsors and partners. Presenting sponsors, Bank of America and Martins Point Healthcare. Cooperating sponsor, Harvard Pilgrim Healthcare. Reception sponsors, Clark Insurance, Key Bank, and Viral. Community Corner sponsor, Goral Palmer. Tomorrow's Leaders and Entrepreneurs sponsors, AAA Northern New England and ProSearch. Coffee sponsor, Skowhegan Savings. Parking sponsor, Vitalius Real Estate Group. Media partners, radio sponsor, WGAN. Print sponsor, The Forecaster. TV sponsor, WMTW Maine CW. Business news sponsor, Maine Biz, with production support provided by Headlight. And thank you to our special community partners, Anthem Blue Cross Blue Shield, Memic, Spectrum Healthcare Partners, Southern Maine Community College, and the University of Southern Maine. And now, please welcome Portland Community Chamber President, Britt Vitalius.
Good morning, everybody. I am not Britt Vitalius, and I apologize for that, but I am going to be stepping into his shoes today. Britt is somewhere much sunnier and less rainy than it is here today. So my name's Quincy Hensel. I'm the CEO of the Portland Regional Chamber of Commerce. It is so great to see people here in person. I want to thank you all for coming out on not only a Friday morning, which I feel like in this time of COVID, Fridays are sort of off limits for meetings, so thank you for coming, and in the pouring rain. So it's great to have a group gathered here today. This is our April Eggs and Issues program. I think you all know what Eggs and Issues is. It is the series put on by the Portland Community Chamber of Commerce, and it's our monthly business breakfast series, and we have been doing this program every single month for I think probably now 40 years or so, and we have not missed a month in COVID, although as you know, many of our programs were virtual. But today we are doing this in person, and also I know we have many people joining us from home live streaming this right now. Today's topic, we're really excited to be presenting today's topic, welcoming the recovery community into the workplace. Now, today's presentation is going to be a discussion amongst a panel of leaders within the recovery community. Collectively, these panelists possess decades of leadership and experience, ranging from workforce, policy, housing, and recovery. They are going to examine the negative effects substance use disorder has had on our state, and how creating recovery-ready workplaces can not only grow our local workforce, but assist in the recovery process as well. Before we begin the presentation, I do want to take a quick moment and again thank our generous sponsors who make this program possible. Our presenting sponsors are Bank of America and Martins Point Healthcare. Cooperating sponsor, Harvard Pilgrim Healthcare. Reception sponsors, Clark Insurance, Key Bank, and Viral. Community Corner sponsor, Goral Palmer. And now today's Community Corner is the Finance Authority of Maine. FAME helps lead the creation of good-paying jobs for Maine people by working at the nexus of economic and workforce development. FAME offers a wide array of business assistance programs ranging from traditional loan insurance programs for small and large businesses to investment tax credits. FAME has also established taxable and tax-exempt bond financing programs that allow strong, creditworthy firms in Maine to access capital. FAME also administers Maine's higher education finance programs. Through a variety of loan, grant, and scholarships, FAME helps Maine students and families meet the costs associated with higher education. To aid in this important effort, FAME also oversees an extensive outreach and counseling program that's designed to encourage young people to aspire to and pursue higher education. They are also the administrator for the state's Section 529 plan called Next Gen 529. Please join us in welcoming members of FAME that have joined us here today. Our tomorrow's leaders and entrepreneurs sponsors are AAA Northern New England and ProSurge, and through this program, the Chamber is able to offer students in the region, both high school and college, an invitation to attend this event for free. I'm not sure if we have students in the room this morning. If we do, can you please stand? Nope, they were all smart and slept in and did not come out this rainy morning. Moving on with our sponsors, our coffee sponsor is Skowhegan Savings Bank, parking sponsor, Vitalius Real Estate Group, and a special thank you to our media partners, The Forecaster, WGAN, WTMW, Maine CW, and Maine Biz. And for more information, we have our FMI sponsor, which is the Portland Public Library. Each month, they provide us additional content and resources that will be sent out to you in our follow-up email of today's event. Our production support is provided by Headlight Audiovisual, and our venue host, the Holiday Inn by the Bay. Thank you for hosting us yet again. We've been here for years, and it's great to be back here in person. And I just want to say for those participating remotely, I want you to know that we have been meeting here in person. We do so safely, and we do follow appropriate COVID protocols. So I hope that you might be able to join us in person soon. And last but not least, I want to thank our special community partners who support all of our chamber initiatives, and they are Anthem, Spectrum Healthcare Partners, the University of Southern Maine Community College, and MEMIC. Would you please join me in another round of applause for our sponsors? Now on to today's topic, workforce solutions, welcoming the recovery community into the workplace. I just want to let people know also from home that we will be doing a Q&A at the end of the program. We have mics in the room, so if you've got questions, you can step up to a microphone. If you are at home watching, you can type your question in the chat, and we will be sure to ask it at the end of the program. So today's presentation will discuss what substance use disorder is, its causes, the effect that criminalization of drugs has had, and what it really means to join the workforce with the stigma of being in recovery. The program today is going to be moderated by the Cumberland County District Attorney, Jonathan Sarbeck. Joining him are panelists Gordon Smith, who is Governor Mills' Director of Opioid Response, Margot Walsh, President and founder of MaineWorks, and Brittany Reichman, Program Manager at the Maine Association of Recovery Residences. So with that, I would love to ask our panelists to come up onto the stage.
Whoa. Is that you or me?
No, it's you, surely. You're next, though, Gordon. Thank you. Oh, my goodness. This is funky.
I'd like to thank Ansel and Tommy for putting this together, and the chamber for all of you here in the room, and for everybody who's, sorry, is this working now? Okay, for everybody who's watching online as well. Guess I'm gonna have to do this. All right. So to get started this morning, I wanted just to ask some questions to the audience, to you all. Basically, how many people here know somebody who either has had or is currently suffering from substance use disorder? Okay, and for people watching online, about everybody's hand just went up. Yeah. And how many people here know somebody that has been arrested or involved in the criminal justice system due to the substance use disorder? Again, most hands have gone up. And the reason I'm asking that question is for basically two reasons. One is the first is on your tables are many copies of Journey magazine. Journey magazine is a magazine that was founded by Carolyn Delaney, who's here, and it really celebrates recovery and gives stories about recovery. But even more importantly, there's some resources in the back of Journey magazine. So if you know somebody who could use some help or looking for some extra support, I would urge you to take a copy with you. And if you have a copy, then you can use that to either give to somebody or help somebody get into recovery. And so it's a great magazine, and Carolyn's coming in right now, so she missed the spot for it, but just want to thank her for that. And the other reason I asked that is because some people might look up and say, okay, why is the Cumberland County District Attorney talking about this and involved in recovery? And I can tell you the reason is we know now, and I think it's come to be pretty widely accepted among prosecutors and law enforcement about what substance use disorder is, and that it is a brain disease. But this is something that's relatively new. And it's something that when you look at the criminal justice system and you look at the root causes that bring people into the criminal justice system, a large percentage of those individuals are suffering from substance use disorder. So it really comes down to understanding why this is happening and then addressing it sort of at the lower level. So instead of just taking that old adage of locking people up or putting people in jail, why don't we try something new and really try to get somebody into recovery, get somebody into treatment? And because odds are, if they're in treatment and they're in recovery, then they most likely are not going to be back into the criminal justice system. So you're going to reduce recidivism, and if you reduce recidivism, to me, you increase public safety. And this is a big step that I think we've been taking in Cumberland County, and it's something I've been a prosecutor for many years. I got my start down in Massachusetts, even though I'm from Maine, but this hasn't always been the mindset. And some of the people who have helped me come to that realization, not just from the many trainings that I've gone to, but people around the Portland area with that lived experience who are in recovery. And also people, because of the stuff that I do as a prosecutor, and I realize that, there are many people who are in recovery that have criminal histories, that have convictions due to their substance use disorder. Because quite frankly, if they weren't suffering from substance use disorder, most likely they wouldn't be involved in the criminal justice system. So what we're trying to do today is really kind of tell those stories and have people realize what that is and how important it is also to somebody's recovery to have employment, to have housing, to have sort of those steady things in their life that probably all of us take for granted. But when you know somebody who's suffering from substance use disorder, you can really understand why those are so important. So I guess we'll get started with Gordon. As Quincy said, Gordon is the director of Governor Mills' opioid response. And so Gordon, my first question to you is, when it comes to the state level response to this, what measures are you taking, and maybe specifically talk about the Recovery Friendly Workplace Initiative?
Sure, and thank you, Jonathan. Thank you to the Chamber and Quincy, and is this mic working okay?
No, one of them isn't on.
I turned it on before I left the table. Let me just see. Oh, it says green.
Seems like it's working.
It is working? It is now, okay. So thank you to Quincy and Tommy and the Portland Chamber. It's a pleasure to be back in this room and to have live events again. Many of you I know from my prior career at the Maine Medical Association. Many of you I know from my new work, like Dan and Larry, and it's just a pleasure to be out and talking and having the opportunity to talk to this audience and the streaming audience about this problem that you're all well aware of, and I can tell you a little bit about how the state's dealing with it. Our plan for 3 years has been focused on prevention, treatment, harm reduction, and recovery support. Recovery coaches, recovery centers, recovery-friendly workplaces that we're here to talk about today, recovery residences. And so I would love to come back and give you the fuller picture of what we're doing and how this is going. But today we're going to be pretty narrowly focused on that fourth pillar of recovery. And I'm also just delighted to be here with Margot and Brittany and Jonathan, people I now work with virtually every day. And I constantly tell people at the state what they're trying to do in terms of getting people from in recovery to give them good employment opportunities. They need to see what Margot has done and Maine Works. She has the street credibility. She's done it. She's done it. And it's sometimes difficult, honestly, being within state government and explaining to people, well, you know, if you take a minute to actually, we've actually done this successfully. So I'm just proud to be part of this panel. I think I'll move right on to recovery work sites, recovery-friendly work sites. And I want to do a shout out before I forget to Brad Page and Liz Torrance from Kennebec Savings Bank, because quite seriously, if they hadn't invited me to be at a program with Margot in 2019, when I'd been in the position maybe a handful of months, we were down at a little venue around Kennebunk somewhere, and it was a beautiful morning, I remember, and the owner of Holy Donuts was there with us, brought donuts. And I learned a lot. I was fairly new to the position, and Kennebunk Savings Bank, because they had the advantage of having some branches in New Hampshire, they participated in the New Hampshire program that they run at the state level, and now there's nearly 300 employers in the New Hampshire program with nearly 100,000 employees within recovery-friendly work sites. And so we don't have to reinvent the wheel in Maine. We can just steal what they're doing in New Hampshire. And they've done in my opinion, they've put some money into it and they've done a wonderful job. Now, what is a recovery-friendly work site? Well, it's a workplace that supports their employees who are already in recovery, working with from a substance use disorder. So while we're going to make some comments about the opportunities we see for you to enhance your workforce, nonetheless, the most important reason to be a recovery-friendly work site is to support your existing workforce. Secondly, that will help also lower the stigma. We can't talk about stigma enough, because despite more than 20 years after things like the Americans with Disabilities Act and parity legislation that says we treat mental illness and behavioral health just as we do physical health, no, we don't. No, we don't. And we all know that. If you've had a loved one who it is, you know, it's not the same. If you break your arm and you go over to one of our two wonderful hospitals here, you're treated one way. You get dropped off at the emergency room and say, I'm withdrawing from fentanyl and I need your help. You will not be treated the same way. Now, we need to get to the point where you will be. And so there is a lot of stigma. And our ability to, I think, work with employers gives us an opportunity to work with a whole group of people that we wouldn't necessarily have an opportunity to work with. And that's so important. As I was explaining to somebody this morning, the best example I give, and I've met with some employers, some with Jonathan's help, and you know, if you have a person in your work, many of you own your own business, many of you run companies, and you are in charge of your workplace. I want you to think about two employees of yours having a conversation at the water cooler once you bring everybody back to the office. And the new employee says to the veteran employee, Jack, we'll call him, you know, I'm really struggling with a substance use disorder, and my use has recurred, and I'm a mess. And is Jack going to say, Jack's going to say one of two things. Is he going to say, boy, don't tell a soul here because you'll be fired? Or is Jack going to say, you are working at the right place. This company is a recovery, you know, it supports people in recovery. You need to go to HR right now and get into our employee assistance program, and we will wrap ourselves around you, and we will help you get through this, and we'll make sure you get to your appointments that you need to on time. Most of the employers that I talk to readily concede they're not at the second place yet. They're not there. But people want to be, and that's what we're here to talk about. And then finally, I'll say that we do find ourselves in Maine in the interesting place where we have thousands of jobs unfilled, thousands of positions that we can't find people to take. And at the same time, we've got thousands of people in early stages of recovery, maybe still using, maybe in long-term recovery, who haven't worked in years. They want to work. Many of them want to work. They want the dignity of a job. They've been discriminated against and stigmatized in so many ways. They don't even think that they can be considered for a job. They have a felony conviction, many of them. If we open our doors to them, these can be, and this is the person to tell you that these can be some of the most dedicated, hardworking individuals in your workforce. So I think for the good of our communities, in support of these individuals, and I know for the good of the state of Maine, if we can match a few hundred of the people who actually want to work or are in recovery, help you be supportive in their recovery, it's going to advance your company, it's going to help these individuals, and it's going to advance the state of Maine. And that's a lawyer's long answer
That's a great
to
answer.
Jonathan's question.
Thank you for everything you do.
And so I think that, and thank you, Gordon. I think that probably brings up the idea that we were talking about beforehand about the mix between the criminal justice system and substance use disorder. The criminal justice system, unfortunately, has, in a way, the laws have criminalized substance use disorder. And so we have become sort of a quote-unquote de facto safety net because a lot of people who unfortunately fall through treatment systems, end up in the criminal justice system. So we try to do our best to basically use the tools that we have, even though they're limited and they're not perfect, especially for this, to try to help people get into recovery. Ideally, people will get into recovery outside of the criminal justice system. But the reason I bring that up, and I'm hoping, Brittany, if you could share your story, if you're comfortable, about your growing up, and just tell us a little bit more about you.
Sure. Thank you, Jonathan. I think it was on. Yeah. Good morning, everyone. I'm honored to be here. I'm always honored to represent people in recovery, and today I'm strangely honored to represent those of us with criminal convictions. So, is that okay? Can you still? Okay, I'll get that after. My name is Brittany Reichman. As Jonathan said, I am the program manager for the Maine Association of Recovery Residences, but more importantly, I'm a person in long-term recovery. When I was 23 years old, I was facing criminal charges for trafficking heroin, for possession of heroin, which I was doing all to feed my addiction. And I remember so vividly that trial, feeling like my two options were go back to prison if you try to fight this and you're convicted, or plead guilty and this is going to affect the entire rest of your life. And to me, I took the choice to plead guilty. And I'm not saying that I wasn't guilty, but there were reasons behind what I was doing. And that was such like a turning point for me. I hope you can't tell this, but by looking at me, but I'm like completely hair illiterate. Can't even braid my own hair, you know? And I'm on trial going to hair school because my family is so convinced that like I'm gonna have to take a career path that my background doesn't matter. And luckily, in my current position, my experience is an asset, but it wasn't always like that. And before I took this job, I was one of those people. And you know what? I'm always going to be one of those people. I have to check the box on every application. Yes, I have felony charges. And my hope for events like this and these conversations is that this becomes like more of a human thing than an HR thing. Yes, I have felony convictions, but there's a story behind that. And I'm not always presented with the opportunity to share that story. Sometimes I just get counted out because that box is checked. And I have to say, as much as I understand in some companies that that's required and whatnot, you're gonna really miss out on a lot of potential amazing employees if that's the only factor that goes into hiring someone. If you put an application to the side because a box is checked, you're really selling yourself short of an amazing workforce. And I want to share a little bit about an experience I had at my former employer, who was not a recovery job, like it wasn't in the recovery field. I worked there for over 4 years and through a relapse as well. So this employer knew my history when I was hired, and they gave me a chance. And about a year into employment, I had a recurrence of use. And I really wanted help. I needed help. I didn't have the finances to go to treatment on my own. I had saved some money. But kind of as a last-ditch resort, you know, I went to talk to the CEO, actually, who had really been an encourager of my recovery. And without any further questions asked, he said, "How much money do you need?" And I told him, and he wrote me a check, and I left that day, and he said, "You come back when you're ready to come back." And so about 2 months later, I returned to work, and every single paycheck for well over a year, I paid back that loan. And that employer, although he doesn't have like strong ties to recovery, and it wasn't, for him it didn't matter, he completely changed the trajectory of my entire life. I don't know what it would have looked like if I hadn't gotten help. And, you know, I really hope that we can impart today the support of people in your organizations and companies that already are in recovery. It's not just about those of us, you know, like hiring people in recovery. It's about supporting those of us who are. And that doesn't always have to be a financial thing. I'm just sharing an example of what that looked like. And that also looked like a year later, I was struggling with some pretty severe undiagnosed anemia, and I looked like I was really not well. And I was taken into a room, and not like accusatory. It was like, "Are you okay? What can we do to support you? Do you need anything from us?" And it was just a conversation, and it was like, okay, my employer has my back. My employer's, I'm not gonna lose my job if I lose my recovery tomorrow, you know? So that's really, if I could impart anything today, it's just like we're more than a checked box if we do have criminal convictions, and every single person has a story. And those of us who are in recovery also are oftentimes gonna have a past and involvement with the criminal justice system, but it's not a part of my future. I remember the day I got off probation so clearly, and now I'm sitting up here with the DA, so. Full circle, you know what I mean? But yeah, thank you guys again for having me. I'm really honored to be here, and leave it at that.
Thank you, Brittany.
Well, one thing I just wanted to say, well, first off, I wasn't the DA back then, right? So
No, he wasn't.
But one thing that people really need to understand, and I had mentioned this before, that this is a brain disease. And one thing that you hear, but some people don't understand, is the term relapse is part of recovery. And I handle the treatment court here in Cumberland County for both people with high risk, high needs due to their substance use disorder, and also our veterans treatment court. And we see that often, and we have to have that understanding, because what that means, it's basically your brain going back to whatever the quote unquote normal is at that time. And it constantly happens. It takes between 18 and 24 months for people to, for someone's brain to heal from opioid use disorder. And unfortunately, it takes, some studies say that it takes about 3 years for people's brain to heal from methamphetamine use disorder. That's a long time. And it's a really it's a situation where it's not easy. When you hear that term, it's every day. For somebody in recovery, it's true. It really is. And some people would say it's every hour. But I bring that up because that's sort of what I really like about Brittany's story, is that she had an employer that got it. An employer that had that understanding that this wasn't a choice, that this wasn't something that somebody wanted to go, quote unquote, live in an alternate reality or anything like that. It was just basically someone's brain going back to where it was beforehand. So, Margot, I'm hoping you can tell us about what your experience has been with MaineWorks and anything else you want to share.
I'm overwhelmed by Brittany's story, because it is the story that MaineWorks hears every single day. And every single person who shows up at MaineWorks shuffles in expecting that they are, in fact, where Gordon said, that further end of the spectrum, okay, I'm now work ready. And none of them understand what goes into full-time employment. and the expectation of full-time employment, normal as it is for all of us, is Sisyphean for someone in brand new early recovery. The obstacles are endless. And so I really love your story and the engagement of your employer to say, how can we help? Because frankly, I think that's the essence of the recovery-friendly workplace, which is, again, I'd like to thank Brad and Liz, my dear friend Liz, to say, there is an organization that stepped in. So I encourage everybody to be the organization that steps in to say, how can we help? And Gordon leading this, what a daunting task, of course. And then Jonathan has brought the entire recovery community together. You know, that's outside of the normal expectation of the DA. We sit on a monthly call, is it monthly?
Every 6 weeks or so, yeah.
But everybody shows up. And the only reason that we continue to show up is because we're all in this together. And that is what you've brought in. And Gordon, to lead this has just been unbelievable. So back in 2010, I wanted to start a business because I was single mom, head of household, and I couldn't work a normal schedule because I have a son on the autism spectrum. So I had to be there in the morning to put him on the bus and there in the afternoon to get him off the bus. And I was volunteering at the Cumberland County Jail in my own recovery. That was just one of the extensions of recovery, is kind of the giving back. And I was at the jail, and I interviewed these young guys sitting around in the circle of recovery, and they were in a pre-release employment program. I was like, why are you guys all working at Denny's? That's a drug den, sorry. The kitchen is not great. And how come you're just coming in and out of the back door? Why don't we see if we can find you a better outcome? And I'm a recruiter professionally. I worked within the investment banking sector in New York, and all I did was recruit. But I was recruiting Harvard MBA and undergraduates from Princeton. Now here I am in the jail setting, and I thought the same principles apply. Find an outcome and help them get there. Because surprisingly, Harvard undergraduates need as much business acumen as these new guys starting out. They don't, everyone comes to it differently. So in the Cumberland County Jail, I asked the sheriff, do you mind if I take a carload of guys out every morning to a construction site? I guess I could find them something, which I did, thanks to the construction industry in Maine. And I had them have the experience of working physically all day long because, this is no surprise, the one symptom that most people in recovery from substance use disorder had in common was that they were taken out of class for one reason or another as children. Mine was profound ADD. Many other behavioral issues are manifest at the early age, of course, and become the substance use is the symptom of that mental struggle. And that's what Gordon illuminated so clearly. Substance use disorder is a symptom of an underlying mental illness. And that's really an important thing to understand. So I didn't understand back in 2010 that every single one of these young people was in the criminal justice system because of behavior derivative of substance use disorder. It was every single one of them. Why did you get arrested? That's where Jonathan comes in. It's all behavior that you would expect. And it was a socioeconomic issue because they didn't have anybody navigating to bail them out. So they were really stuck there. So all I wanted to do is provide some traction. And that traction has evolved to 2017. We started a 501c3 nonprofit called Maine Recovery Fund. All we do at Maine Recovery Fund is answer the question, and now what do you need, and now what do you need? And by the way, the retention at Maine Works is a very difficult number. Our attrition, I'll put it this way to give it a more context, is 70% within the first 2 weeks. And every one of those people, the 70% who don't make it, showed up thinking that they were work ready. So I need the help of the entire community to engage that population. So the community college system or the high school trades programs, let's go further upriver to see how we can avert that number from the 70% of the 300 W-2s we sent out last year during COVID. And everybody kept working during COVID. That's another whole other story. So I think the most important thing that Kennebunk Savings Bank and Journey and the Chamber of Commerce, be the bridge builder, be the connector. Find out what resources are available to you as an employer that you can use best practices. Don't, hammer out the stone into a wheel and then roll it out into the middle of the interstate. It's already happening. Talk to the people that you know are inherently connective and ask them to help you then access best practices within this. Because it is all about humanity, as you said, Brittany. I hope it's not an addiction problem. It's a human problem. Every single one of you in this room identifies with knowing someone who's struggled with drugs and alcohol. Most of you knew someone who has been arrested. So it is not a closet issue. It is very much part of our mainstream. It is who we are. And I think that, as Gordon was saying, I'm hoping that your mental health checkup will be as ubiquitous as your physical checkup that we all go into willingly every year, and then kind of bristle at this questionnaire they now have for us all that says, are you safe at your house? That's kind of a probing question. So, but that's what we need to be doing, is taking care of each other from a mental health standpoint. And I'll end on this. Did anybody watch Ted Lasso during COVID? Hands up if you saw Ted Lasso, any part of it. Okay, so when Ted Lasso is playing darts with Manfred in the pub, and Ted Lasso kills it, he gets perfect score, Manfred recoils, and Ted Lasso tells a story about one of his coaches along the way said, it's time to be curious, not judgmental. And we are in an environment where curiosity hopefully will prevail. Take interest in each other and take care of each other. And I'm delighted to be here. Thanks. So I don't think I even answered a question. I think I just went on and on. Typical Mario.
Yeah, and I will just also, in the effort of making people know about what's out there in the community, like Margot just said, if people aren't familiar with the Portland Recovery Community Center, I would ask that you look it up. Leslie Clark is the director of the Portland Recovery Community Center, and that is a resource that has been vital for so many people in recovery, and it's also been a model for more recovery centers throughout the state of Maine. We also, in Cumberland County, have the Lake Region Recovery Center up in Bridgeton, too. It's located right directly behind Bridgeton Hospital, and they work a lot with Bridgeton Hospital and Crooked River Counseling. So there are resources out there. I mean, we could always use more, don't get me wrong, but there are a lot of things out there. And what is that, the 16th? Recovery? 18th Recovery Community Centers that we have throughout the state. Augusta just opened one as well. So I think that's all from us right now, and we're going to...
I just wanted to say, well, what are we doing in Maine about promoting recovery-friendly workplaces? And there's quite a few little initiatives that we found a little money, take me a little time, to bring these all together, so that I really do believe that in 12 to 24 months we'll have a statewide program just like New Hampshire. But right now, we have a pilot project going on in Washington County. Brad Page has helped me with that by setting me up with the president of Machias Savings Bank. We have a big presence in Washington County. And so right now that is being designed, and then for the next 6 months, and it's being funded privately by the Maine Community Foundation. So that's a good pilot, while we're on the state level getting together a plan to do another pilot that we do have some state money for, that will probably be, it will at least be likely in York County, and maybe we can put enough resources to do Cumberland and York. But we don't want to roll out a program and not be able to service. We want it to be real. It's easy to say, oh, I'm going to be certified. I certified today that my workplace is a recovery-friendly workplace. But then when you call me and say, I'm ready for your work site, to send in your work site advisor to train my staff, then this takes people, and it takes training, and it needs to be a real program like New Hampshire's. But we do have these initiatives going on, and particularly in Washington County and in York County, and we'll wrap it all together. And I think maybe even within 12 months have a statewide initiative and be able to assist you with taking that step.
Great.
Thank you.
That's great.
So unless you want to share anything else, I think we're going to open it up to questions. from the audience.
Good morning.
Morning, Tom.
Great presentation and discussion, by the way. Thank you. Round of applause for all the presenters. My name's Tommy Johnson. I'm with the Portland Regional Chamber of Commerce, but this question comes to us from our friends on YouTube, from Katie Harris at Maine Health. Two-part question. To Margot and Brittany, what gaps exist in Maine's treatment continuum?
You want to take
So
that?
I just saw Katie. I saw Katie in the parking lot of a restaurant the other day, and we had, as typical of Katie, had a fast and furious conversation. Hi, Katie. But that's the nature of being in Maine. It's the connections, and we all know what we're all up to, but yet we don't have a chance to get together that often. So, Tommy, I think that's a great question. I feel that and I know that Ron Springle has been really involved in this discussion, and it's so important because people need immediate access to detox. That, to me, let's have a round of applause. That is what we need, immediate access to detox. I have received the hand-wringing conversation with the parents with the phone book in their lap, going through to try to find out, to address the issue that Gordon raised, which is when you present at the ER, it should be an automatic admission, even just to go sit in a room with a lazy boy and a Gatorade, to get through those first, and then to have someone discuss with you what your treatment options are. But you cannot send this population back out onto the street that is deadly. In fact, I bet there are statistics to support how deadly that is. So if you hear someone needs help today, they do not need help next week. You need help today. So I think that's the most obvious. Would you say that?
I would completely agree. There's such a lack of instant access. I've lost friends weeks later who I sat outside of Milestone Detox because they were full and they didn't have the capacity to take another person. And 1 week later, that person overdosed and passed away. So when somebody decides that they want, okay, I want help, that can be the most fleeting moment in the world. It can be gone a half an hour later. Yep. And so if somebody wants help, we have to have somewhere that we can take them. And we don't always. So yes, I would agree.
Yeah. I met with Milestone yesterday. We have exciting plans to go from 16 beds to 24. Great. We have money. We have the biggest challenge now is we have money for renovation and capital. We have detox projects probably in 6 different places because absolutely we need these beds, and we need residential care after the 5 to 7 to 9 days of that. Many people need a lot in that early period, and we don't have enough residential care. Now, so we have plans to, in fact, do that. The biggest barrier now is what you experience in your business. It's workforce. I could have all these places open, and if I don't have nurses and counselors and medical professionals to do the work, those beds can't open. So that's where the community college system comes in. We have plans. It's very difficult in my position to ask people to be patient because when you've lost friends and family members, I don't ask people to be patient. But I do believe that we have more resources, we have help on the way. The pandemic really hurt our work in a number of ways, but the plans are there, the money's there. This will get better. My job is to try to keep people alive to get them into that treatment bed and get them into that detox.
And just to piggyback off that, from the law enforcement side, especially from the police side, most departments around the greater Portland area and many other places in Maine have substance use disorder liaisons, have mental health liaisons that actually help law enforcement officers, help police actually connect with somebody who's suffering from substance use disorder that law enforcement accounts or that they encounter. So it's not an arrest first or anything like that. They actually call these individuals who work within their departments who then try to connect them. Unfortunately, though, as Brittany said, it's that moment where they need to be able to connect them with something that's going to be there, that's going to be able to help them, that's going to be able to get them in bed. And probation, through the Department of Corrections, has taken a new approach as well with a harm reduction approach in trying to get those people resources. But I've gotten calls from probation officers asking me, Jonathan, do you know of any treatment beds available? I have people who've come into my office that say, I need help. And even a probation officer hasn't been able to hook that person up with resources. So when you have a probation officer who should have state resources at their fingertips and they don't have it, think about the parent out there Think about the spouse out there that says, my husband, my wife, my kid, this is the day they need help, and they can't find it. It's scary.
It's deadly.
Deadly.
It's deadly. And one more thing for Katie and the people that might be watching. I think that the most important part of what Katie asked is developing a continuity, developing a continuum of care where there's someone invested. When I have people that are on probation, I breathe a sigh of relief because they're in the care and custody of that PO, frankly, or accountable to someone. Because it's so easy for people who don't have those skills to navigate. You know, if you've derailed your life with the use of drugs and alcohol at the age of 14, 15, how old were you when you started using?
17.
I was 15. I drank all the time, whenever I could. So we have not developed normal executive function, period. So to be then in a whole new world without substances to support whatever kind of mental health crisis we feel like we're in all the time, and then you don't have anybody that can help you navigate that, you can't expect normal navigation, especially if people, and the age, as you probably know, Gordon, is getting younger and younger and younger for people to become deadly, addicted in a deadly way, in a life-threatening way. What is the average age of fentanyl overdose? Probably like 20-something.
No, it's actually 41, but you're right. People use it younger and younger ages. I had a 14-year-old in this county that we tried to help this week, and she's doing okay with her mom, but we were not able to get her into a residential place because we're trying to reopen Day One's girls' residential facility. So we need to do a lot, and right now it's just a very dangerous time. It really is all about fentanyl, and it's killing a lot of people, and it's just heartbreaking, and we can't give up to that despair. We need to do better.
And one thing too I just want to mention is we had an individual in our treatment court, a client, and this was actually pre-pandemic, so it was 2019, and the judge basically said, well, I think that you need to go find employment. And she was about 24, 25 years old. And we realized a couple of weeks later when she wasn't getting a job that because she had started, her substance use disorder started so early in her life, probably around 12 to 13, that she never had summer jobs. No. She never had that experience. So the idea of a resume, of showing up on time, of answering to a boss, of doing what the tasks are as part of your employment, she had never gone through. And I mean, I started working when I was like 14 years old and doing a summer job. And I'm sure a lot of people in this room had that same experience. There's a lot of people who are in recovery that don't have that experience. So just sort of those basic steps that probably a lot of us take for granted, some people don't have. So it's also that patience that people need to really have that understanding about what somebody has been going through for so long and has been suffering for so long.
Let me say something hopeful. Jonathan and I and Brittany were at the Wyndham Middle School 2 months ago, and we go back next month to see their projects. There's a project for 7th graders. That's aimed about right. Not being in recovery myself, I let people in recovery know that I really need to listen to them, and I always ask them when did they start going down this road, and is there anything that could have been done at that time to help them? And this really is, there is a reason that people take drugs, and it's because they don't like the life without drugs. And this is, they experiment with alcohol when they're 9, 10, 11, 12, 13 years old, and then they go to marijuana, and then they get pills, and they can't get pills. All of a sudden they're 19-year-old and they're injecting heroin, except now it's fentanyl. And the only real way out of this for Maine and this country is prevention, primary prevention. Not so many people starting down that road, intervening with them, secondary prevention if they've all got risk factors. I mean, as you know, we have hundreds of grandparents unexpectedly raising their grandchildren because their parents are in prison or deceased. We need to spend a lot of investment in that age group, and we need appropriate curriculum and teaching from pre-K. We need universal pre-K to grade 12 and all the way to age 26 when our brains, if we haven't used drugs, are formally developed. So, but we are doing all that. There's some tremendous prevention work being done in the state. So over time, That is how we get out of this. Otherwise, we're just rearranging the proverbial chairs on the Titanic, trying to keep people alive, trying to get them into treatment, and it is so difficult to get one into recovery and to stay in long-term recovery, and we understand that. So the best way to do that, don't start.
Right, and there also needs to be a community education about trauma and what trauma is and adverse childhood experiences. I think we're trying to stay away from all those bigger issues because we don't have a lot of time.
We could be here all day.
Right, but if you don't know what adverse childhood experience is, please do yourself, do your community a favor, get out there and get educated, because the correlation between substance use disorder and adverse childhood experience, it's overwhelming.
Great. So a question for you. My name is Jim Cohen. I'm with Viral Dana, and first of all, thank you so much for being here. I have spent more than 25 years working with opioid treatment providers, with medication-assisted treatment, and the fact that this panel is occurring today, and the kind of work that all of you have done, and the fact that the Chamber of Commerce is hosting this event, just as a testament to how far we've come in the last 25 years. So first of all, thank you to the administration for all the great work you do. So thank you. So my question, as a member of a large business here in Portland and regionally, and for all the businesses who want to get engaged, could you just walk us through what are the best sort of steps that a business takes to become a recovery-friendly business? What's the way to get there?
Can I put my friend Liz on the spot with this? Liz, where are you, my friend? Liz, the pillars of a recovery-friendly workforce. We talked about it the other day, and you rattled them off, and I would have to go into my ancient brain and try to remember. What are the pillars of the recovery-friendly workplace?
So it's policy. Look at how you look at your HR policies in treating substance use disorder as an illness as you would any other. It's education to reduce stigma, and then it's providing resources for support.
So that's my example of deferring to the professionals, people that have lived in this space and know this inside out. So if you don't know about Liz and the work that Kennebunk Savings Bank has been doing in New Hampshire with Recovery Friendly Worksite, Liz Torrance is an incredible resource, and I'm sure would be happy to have a conversation so that we're not recreating the wheel in each organization. That is hopeless, and that's counterproductive. So Liz, thank you, and for being on the spot.
And so that was policy, education, and resources. Okay.
Hi, my name is Abby Peck. I'm the Director of Corporate and Government Relations and Special Events at Maine College of Art and Design. Mine's just a comment. I want to say thank you so much for this, and thank you to Brittany for sharing your story. I've lost 3 friends to addiction over the past year or two. In fact, one was just last week. You know, she didn't get the help she needed. She was a very talented artist and fashion designer. She wasn't here in Maine, but she kept getting let go of jobs. And maybe if she'd had the help she needed, she'd be here. She left behind a 12-year-old daughter and a 15-year-old son. And she just couldn't get the help. So I'm very lucky we have an EAP, an Employee Assistance Program at Mecca A&D. So I just hope a lot of companies do get that, because it's important and it's necessary. And you're right, physical health is absolutely, you know, you can take time off, you get sick days, but do you get mental health days?
No.
You know, so, and we don't talk about it. So I think we should. So, you know, thank you so much for being here. I was really happy to come here and hear this. So thank you.
Thank you.
Sure.
Yeah, good morning. My name's, is this on?
Yes.
Yep. My name's Dan Bellier. I work for the Maine Community College System. I'm the Chief Workforce Development Officer, and I am a person in long-term recovery. I want to, we can't underscore the voice that Gordon and Margot has put out for us in getting this message out, because you have pushed us, the community college system, to move forward and start talking about how we can train folks who are in long-term recovery, who are entering recovery, who are departing corrections, all of those important populations that we need in the workforce. And I want to thank you, Brittany, thank you for your story, and Jonathan, thank you for the work you're doing. Margot, can you talk more, maybe a little more about work ready skills, what you're seeing, and the importance that's playing in the role that you're in?
Yes, and how are we doing with time?
It's about 8:57.
Okay, so I'll just speak for a minute. Thank you for that great question, Dan. Again, as I mentioned, everyone who shows up at MaineWorks has been kind of washed up, frankly. And so we used to have our morning circle, which was a way to really literally invite people to come in and immediately feel part of something, kind of going back to in all of our DNA, was that gathering around a fire was what we all have in common, generationally. And so, but I will say that when people start over, they normally don't connect to what their aspirational goals are. They're only trying to keep their nose above water. And so what we're trying to do at MaineWorks is engage keeping your nose above water. And if you can then navigate those urgent things, triage what's wrong, eyesight, dental care, all these things that are wrong that you can't really take time off from a traditional job to go manage, that's what MaineWorks allows. And then we try to connect people to aspirations. And that's why Charlie Collins has come to the circle and talked about community college, talk about developing trades, skills, training. We love that kind of thing. But we really recognize, and MaineWorks exists to provide that barrier between completely washed ashore, not knowing what they're going to do, to starting to feel like they have aspirational goals. And in many cases, it's the construction industry, in my case, because it's merit-based and they don't check the box and they don't care about the box. And there's lots of opportunity within the construction industry, regardless of your skill set, which I think is amazing. But that's not to say that doesn't exist now more unilaterally, given the awarenesses that you guys have started to build. So I think that the most important thing is to triage the moment. Where are you right now? What do you need? And that's the essence of work ready. And how do you get there, by the way? Last year our budget was devastated because of transportation. How many people here know someone who can't get to work because they don't have a car? Well, we see it. We live in that space. And without that, they're rudderless. Totally rudderless. So transportation is the big one, and a safe and secure place to live, which is Maine Association of Recovery Residences. Let's find stability. It's Maslow's hierarchy of needs, right? If you don't know where you're sleeping or what you're eating or how you're getting there, aspirations are out the window. So that's what we are hoping to develop one day at a time.
I think we have time for one last question. This comes from Miles Robert of the Portland Public Library. Really quickly, if you can answer, what's the best organization for a business in Southern Maine to reach out to if they want to begin learning? Would it be MaineWorks, perhaps FAME? Could you maybe, and again, if we don't have the full list of answers, maybe we can include this in our post-event email that we send out to everybody tomorrow.
I would go to Gordon on that
Well,
one.
we're going, our websites will have the resources available to work-friendly work sites. But honestly, you can reach out to Liz. The peer-to-peer is really important, one company to another. Kennebec Safe has been very generous with their time and capacity to tell you what they do to be a recovery-friendly work site. Margot's generous with her time. You can call me. Don't despair. 75% of people with substance use disorder get into recovery. You get 3/4, you get 3 chances out of 4 to live and find the joy in your lives that many of us experience every day. So don't give up. Help people, and that's my last message for you today. Don't give up on people.
Wow, that was incredible. I want to thank you guys. I'm like choked up over this presentation. You guys have been awesome. Brittany, I am so impressed with you being here and for dedicating your life and your time to people who are in recovery or need to be in recovery. So I want to give you a round of applause. And Margot, I would follow you anywhere. You're amazing. She's a powerhouse, and she's like making incredible things happen. So Margot, thank you for being here and everything you do. And Gordon and Jonathan, I want to thank you guys for putting your influence and your energy towards this topic. You guys are really making a huge difference and really elevating this amongst our community. So thank you. And just to reiterate something Jim Cohen had said, I am so proud that the Chamber is putting a spotlight on this issue. And I think it's so important for people to know that if you are in recovery or need to be in recovery or want to be in recovery, there is support and resources for you. If you are an employer who wants to be supporting your employees who are in recovery, there are resources for you. I think this was such an eye-opening conversation. There's a lot of work that needs to be done in this space, but I have no doubt that with these individuals on the stage, with all of you who are committed to bringing about change and supporting people who need the support that they need, that only great stuff is going to come from this.
Thank you.
Thank you guys so
Thank you
much.
so much.
And I feel like with that, like Tommy's going to like be mad that I'm not going to close this out because I feel like it's like a mic drop. This is the end. Thank you so much for coming. We will see you guys in May. We are doing our annual event. I don't even know when it is. Thank you. June 16th. Thank you, Morgan. We will be doing our annual event at Ocean Gateway June 16th, so I want you to mark your calendars, and we will see you all back here in May. Thank you for joining us.
Thank you. Thank you.
Thank you.